PCN Manager. I'm pleased to welcome you to our Seacroft Primary Care Network podcast. It's a chance for you to meet the people involved in your care and to have an insight into how practices work together to create the network. Today we are meeting our PCN Pharmacy Team. Please can you introduce yourselves and provide a brief overview of your role within the PCN Pharmacy Team.
Hi, my name's Elise. I am the lead pharmacist for Seacroft PCN. So as well as doing clinical work, which the other pharmacists will go into, I also provide leadership to the team, which means deciding on kind of what work streams we're working on and that we've decided at board level with the other practices that work within the PCN, what the priorities are. And then I help implement those work streams within our pharmacy team. I also provide a bit of education and mentoring to the pharmacy team, and I also provide them with line management.
Hi, I'm Shreeb. I'm one of the clinical pharmacists in the team. So I work alongside the rest of the team and do medication reviews with patients to help make sure the medication they're taking is best for them, as well as some other stuff that we'll talk about further in the podcast.
I'm Melissa. I'm also a clinical pharmacist. Like Sho said, we do medication reviews and we also answer clinical queries from some of the other healthcare professionals within the GP practices.
Hi, my name is Sharon. I'm also a clinical pharmacist. I'm very new to the team. I've joined this role for a couple of months, so I'm still learning, but I'm in very good hands because this is an amazing team and I feel really lucky.
Hi, I'm Sam. I'm the pharmacy technician who works with the team. My role is kind of information gathering in the background for the pharmacists for medication reviews and queries, and then actioning medication alerts and working on projects to help improve prescribing and patient safety in the team.
Okay, fantastic. So how do you as a team work with other healthcare professionals, provide care and support to the patients in Seacroft?
So as a team then, we work over the 4 practices in Seacroft. This includes Park Edge Practice, Foundry Lane Surgery, Oakwood Lane Surgery and Windmill Health Centre. We work closely with the practice staff to provide medicine-related support for the practice. This often involves complex and in-depth medication reviews to make sure you as the patient are on the correct medicines for your different medical conditions. We have a bit more time than the GPs, so we spend time looking into the reasons why you're taking each of your medicines, making sure you're on the correct dose, making sure it's working for you, and addressing any problems that you might have with your medicines, like side effects. During the medication reviews, we try to look at you as a person instead of a bunch of medical conditions. So we might suggest adding in treatment or reducing doses of your current medicines, or even stopping unnecessary medicines. So we work closely with you as the patient, with the doctors and the prescribers in the practices to make these changes to your medicines and help you get the best out of your medicines. We help the doctors and the nurses in the practices implement medication changes following, say, a blood pressure check or a diabetes blood test. We also work with the doctors and the nurses from the hospital to action medication requests from clinic letters. For example, if you attended like an eye clinic, they might suggest a new eye drop for you. So we would check that eye drop is suitable and then set up the repeat prescription for you. We would also call you and explain how to use the eye drop and make sure that you have enough information about that medicine. If, say, a hospital clinic letter had asked us to arrange a blood test for you in 3 months, the pharmacy team might also make sure that that's in place if necessary. We work closely with other members of the PCN too. So one of the teams in the PCN is called the Proactive Team, and they look after frail and vulnerable people in Seacroft. So we often do medication reviews for these patients that the Proactive Team are looking after, and make sure that the medicines that they are on are appropriate for them and help improve their quality of life. Additionally, we have 7 care homes within Seacroft, so the pharmacy team do all of the medication reviews for the care home residents, and we answer medicine-related queries from the doctors to help with care home residents, and we also action acute requests, so one-off requests for care home residents.
So, please can you tell me what projects you're working on?
So we're working on quite a few projects at the moment, and the projects tend to vary between stuff we're working on alone as a team and stuff we're working on in partnership with other healthcare professionals. The aim of these projects is basically to improve patients' healthcare and their experience, of healthcare. The first project that we're working on with the GP practices is trying to help reduce people's cardiovascular risk, or in other words, reduce their risk of a heart attack or a stroke. So we're doing this by just reviewing patients' cholesterol and seeing how good their control is, and just seeing if there's anything we can do to make that better and improve their cholesterol control, because that's one of the risk factors that increases your cardiovascular disease risk. So if we can reduce that, it can make a big impact on the future risk of heart attacks or strokes. We're also working on a project where we're reviewing prescribed medication to see if the patient either still needs or if there's something more cost effective without compromising the patient care. The savings that we can make from that will help to kind of move the funding more towards enhancing core NHS services. Alongside the above, we're also keeping on top of any national alerts or any medication recalls, like any new side effects to let patients be aware of. And this all ties in with what Mus has already talked about. On top of all that, we also help to increase capacity and access in the GP practices by providing extra appointments to deal with like any medication queries.
So with this in mind, what are some of the challenges faced by the pharmacy team, and how do you address them to maintain high quality care delivery?
Some of the challenges that we deal with on a day-to-day basis are, one for instance is primary care is made up of multiple team members across all 4 practices. So sometimes one of the biggest issues is communicating effectively between everybody. And I think patients really struggle with feeling like things aren't getting through to other people because there is so many different people involved in their care. So one of the things that we try to do in the pharmacy team is any conversations we have with the patient are written up fully in their notes, and we liaise with other professionals in the team to let them know what's going on as well, so that everybody's informed about the patient. Or for instance, when there's medication changes from the hospital or from a clinic letter, we will liaise with the patient and the pharmacy so everybody's aware of the changes and the patient's having their medications updated and dealt with in a timely manner so that there's no risk to you guys and you feel like you're getting the care that you deserve. So another challenge within our team is that we occasionally work from home. This is because there's such a big team across primary care. It's not easy to always be present in the practice of the patient that we're talking to. Sometimes when that patient requires a face-to-face, if we're at home, obviously that's not possible. So what we can do to work through this with patients is we will always offer the availability of a face-to-face appointment at a practice with the pharmacist who is in that day and is available. And even if that isn't appropriate because a patient's housebound or they're struggling and they just can't get out at the moment, we have the availability to offer a home visit as well, just to come and see you in your own environment and see how it is that you're getting on and what it is you're struggling with. Sometimes it's better to see you face to face in your own home so you can explain things to us properly and show us your problems in your own environment that you deal with day to day. And we know that this is a challenge when we sometimes work from home. So we work through that problem with yourselves in a way that we can help you. And if that means someone else in our team helping you in a different way, we will make sure that's communicated to them so that we can provide that service for yourself.
So can you share some examples of how the pharmacy team has positively impacted patient outcomes or helped in managing chronic conditions?
Like Sam's just touched upon now, we do offer home visits as well to manage especially patients on polypharmacy, which basically means on lots of medication. Sometimes we can, because we work closely with there's care coordinators as well within the primary care network that go out to see complex patients or frail patients or patients that are having repeated hospital admissions, because sometimes there can be other things that are going on that need looking into. And as part of that, when they go in, sometimes if it's highlighted that medication taking is an issue, they can, because we work very closely with all different members across the primary care network, they will come and tell us about it, and then we can go either as a joint visit with the proactive care team, or we can go out individually and we arrange a suitable time for that patient to, like Sam mentioned, go and see them in their own home. And that can provide us with valuable information sometimes. For example, if they're struggling with remembering to take their medication, or it's too much medication, and sometimes, you know, we can go in and there's excess amounts of medication around the house, which kind of, you know, indicates to us that there's maybe an underlying issue here, and we can explore that with the patient and put a plan into place to try and improve that. So, for example, if it's too many medication, we can really dig deep, look at the most recent up-to-date bloods and their clinic letters from specialists to see, is this something they still need to be taking, or can we actually reduce that medication and take it off so it's one less thing for them to take? Or if we can simplify the regime in any way. Or sometimes it can be something we can put into place to help them to remember to take their medication. For example, I'm sure you'll all be familiar with the weekly trays, known as dosset trays, that the pharmacy make up. So if they're struggling with lots of individual boxes and we go out and we can see them and they're able to tell us that, we can then come back and we can arrange with the local community pharmacy to start delivering and make up weekly trays to make it easier for the patient. And sometimes just going in or having these really in-depth medication reviews can highlight kind of any medication issues that might be the reason of such repeated hospital admissions. So sometimes not taking medication can be the cause of somebody not recovering from something and ending up back in hospital, because either they weren't clear on the hospital regime when they left, on the medication regime, or it was too much for them, or they didn't have the right help in place to be able to comply with that regime. So we really go in and help them put things into place to make their life easier.
That's great. Thank you very much, Elise. So that draws us to the end of our first podcast for Seacroft PCN. So thank you to everyone for attending, and I look forward to you joining us next time.
Bye.
Goodbye.
Thank you.